All right, well, good afternoon, everyone. I have 2 o'clock on the dot, and I like to be cognizant of everyone's time. So first, let me say thank you for joining us today. My name is Corbin Granger. I work with compliance here at Towne Benefits, and today we are discussing the riveting topic of the gag clause prohibition compliance attestation. And no, I will not say that 3 times fast. That one is really a tongue twister. But what I'm going to do today is go through what it is and then a tutorial of how to attest. Thankfully, it's relatively simple. For those of you who've attended my webinars before, we'll go through the presentation. You're welcome to put in a question, and then I'll get to it at the end. Also, I do send a copy of the slides, and in this case, I'm also sending the web form instructions, the user manual provided by CMS, and the reporting Excel template that maybe 1 or 2 of you may need to use. And that goes to everyone who is registered for the webinar, not necessarily who attended. So if you had someone in your office who registered but couldn't attend, they will get a copy of the slides as well. So with that, let's go ahead and get started. So of course, this is a new provision. And like any provision, things are subject to change. This is overseen by the IRS, the DOL, and the HHS. So this is not meant to be legal or tax advice. If you have a legal or tax question, please seek out your specialist in that area. Now, why does this provision exist? And really, it goes back to December 27th, 2020, when the Consolidated Appropriations Act was passed, or called the CAA. And there were many provisions in there regarding health plans, actually COVID, a lot of different things. But one of the provisions involves what we call gag clauses. So group health plans, so in general, we're referring to self-insured health plans, and health insurance carriers themselves are prohibited from entering into agreements. So that would be the provider agreements, your third-party administrator agreements. Maybe you use a separate pharmacy benefit manager or a wellness program that qualifies as a group health plan. Any vendor with a contract that includes what we call a quote-unquote gag clause. And I'll explain that in a moment. So what plans and issuers have to do is they have to go to a CMS web portal and attest that their contracts do not contain such clauses. The first attestation must be submitted and by December 31st, 2023, but it covers a roughly 3-year period. So that's from December 27th, 2020 through December 31, 2023. So I have included in these slides all the responses from the fully insured carriers and TPAs that we work with that have responded to us about how they're handling the gag clause. So this presentation is for a client that has or had a self-insured plan or plans during the 2020 or 2023 period, and they must attest because with limited exception, if you have a self-insured plan, it's probably going to fall on the employer to attest. Or the group health plan is using a separate vendor or separate network, and they must attest as the vendor is not doing the attestation. So it's kind of a strange rule because you really have to go, as you'll see, go through this CMS portal, and you kind of promise that your contracts do not include gag clauses. Now you may be saying, well, we don't, even though we use a TPA, we don't really negotiate those contracts. The TPA does those on our behalf. And of the carriers and TPAs that we've had responses from, they actually are in compliance with the rule. So you could ask them for confirmation, but I would say that you have a good faith, reasonable expectation that they are complying with the rule. So what exactly is a gag clause? So it's a contract or a service agreement that includes what they call prohibitive or restrictive language. And that's all around claims, especially pricing, like with provider pricing and other data. And the whole thing is for the purpose of transparency and access. You may not have noticed, but there are a lot of transparency provisions in recent law relating to benefits. Hospitals have to be transparent about posting their costs. Providers have to make costs available publicly in certain areas. And so restricting information on claim information, rates, service codes, provider names, that's prohibited. I think in terms of, you know, if any of you go to the grocery store and you look at items on the shelf, you can see, for example, you can look at the price per pound or the price per cost. And so you can make a decision about what you're going to purchase. And so, for example, I'm always going to get Duke's mayonnaise, even though it's more expensive than other mayonnaise because it's my favorite, but they're being transparent about that cost to me. This whole thing is about taking medical costs from behind that curtain and making them more transparent to the consumer and to the public. It doesn't mean that they can't put certain restrictions on public disclosure. Not everything has to be public, but in general, a lot more information has to be available. So an example of a gag clause could be, let's say you have a TPA and you have a self-funded plan. So the self-funded plan really is the plan and the issuer of the plan. But the plan sponsor or the employer can only get access to provider cost and quality of care information at the discretion of the TPA. So if they don't want to disclose what your reimbursement rates are under the plan, because they consider it proprietary, they're not going to. And that will be considered a gag clause. Or maybe you have a contract between a TPA and a group health plan. It's very similar. It states the plan is going to pay providers at what they call point of service rates. But again, they consider the information to be proprietary, and the plan can't disclose the rates to plan participants or beneficiaries. So that language is also a gag clause. So who must comply? Why are you attending this webinar today? So insurance carriers providing individual and group health plans. So we're talking about fully insured plans here. So the insurance carriers have to attest. However, the group health plan itself is responsible for the attestation. So meaning under the law, the insurance carrier and the group health plan, and that means if they're covered by ERISA. So that means any private sector health plan out there, including a grandfathered plan, has to attest. However, as you're going to see on the upcoming slides, if your plans were fully insured from December 27, 2020 through December 31st, 2023, then if the insurance carrier attests for you, then you do not have to attest. It also applies to non-federal government plans, so county plans, state plans, and what we call church plans. What benefits are excluded? Well, it doesn't include what we call accepted benefits. So vision, dental, what we consider your voluntary benefits often, like your fixed indemnity, hospital indemnity plan, disease-specific plans, long-term care, accident workers' comp. We're really just talking about group health plans. It also does not include account-based plans such as health reimbursement arrangements or individual coverage HRAs or qualified small employer HRAs, okay? It's really group health plans. And it does not apply to what they call those short-term limited duration plans that are out there, mainly on the individual market. So who can attest to compliance? As I said, fully insured plans in general, the carrier is going to attest because they're required to submit an attestation of their own. So if they are attesting, that's going to satisfy the requirement of the plan or the employer to attest. By and large, with very limited exception, if you have a self-insured plan, the plan sponsor or the employer is probably going to have to attest. And remember, I'm going to say this more than once. The first attestation covers the period from December 27th, 2020 through December 31st, 2023. So if you had a mix of fully insured and self-funded plans during this time period, you may be required to attest. So if you were fully insured with Anthem in 2023, but you were self-insured with Cigna in 2020 and 2021, then you're going to have to attest for the period of time that you were self-insured. So who are the carriers submitting on the plan's behalf for fully insured plans? Well, Anthem is for fully insured plans. It also applies to the small group, what we call MIWAs, or Anthem Balanced Funding, minimum premium, and federal employee health plans. Aetna is filing for its fully insured plans. It is also filing for its self-funded clients. That is the one exception. Cigna is filing for fully insured plans. Optima is filing for fully insured plans. UHC is filing for fully insured plans. Self-funded plans that must attest. So the plan sponsor or the employer in these cases are responsible for submitting their attestations. They're also responsible. So when you have a self-funded plan, even though most of them are integrated, meaning when you use the third-party administrator, you get your medical benefits, your pharmacy benefits, your behavior benefits. They're all integrated through that contract. If you have carve-out vendors, so you have a separate pharmacy benefit manager from your behavioral health manager, you have to check with those vendors to see if they attest or you attest. So if you have an Anthem Administrative Services only contract, you are required to attest. There is an exception if the employer completed Anthem's online form by August 15, 2023. If you don't know if you did, you can ask your broker or Anthem. Anthem, what they call JAA and MCS, Managed Care System clients. And Allstate, I'm thinking their answer is going to be the employer has to attest, but I'm still officially waiting on the response. Self-funded plans, Cigna, the plan must attest. Optima, which is now called Centera Health Plan. There's also an exception here if the employer completed the link and provided the data to Centera Health Plan by October 1st, 2023. If you have a question about that, you can contact your broker or Centera. Now, UHC will provide a confirmation of compliance for the benefits they administer, but it's up to the employer to attest. So they're actually giving you a confirmation of compliance. If you have a special arrangement, so such as a customer-sponsored provider or a group-specific provider network, and some other carve-outs, like including Optimum RM Direct, you need to work directly with your broker with those third parties for attestation. And so for Optum RX Direct, you can check with your broker who will check with your Optum strategic account executive. I know that sounds like a lot, but that's probably not going to impact many clients. Lease Network should also provide a confirmation of compliance. Now, is there a penalty? And there really isn't so much a specific penalty, but the IRS has hinted that plans and issuers that do fail to attest can be penalized $100 a day for an attestation that is not filed. I have been told that they are not looking to penalize anyone, that you can use reasonable good faith to do the attestation. Their goal here is just transparency and to have the plans attest. So let's get into how to submit the attestation. And the attestation has to be submitted one way using a CMS web portal. So before we go into it, you'll see some terminology, and I didn't use all of it that's in the instructions, but some of it that you'll see in the instructions. It's called the GCPCA platform, the Gag Clause Prohibition Compliance Attestation Platform. That'll be a quiz question. A reporting entity. So that is the plan. So if it's self-insured, it's the plan, or it's the issuer. So if it's fully insured, the carrier. And those are the ones that are subject to, those are the code sections, ERISA and the Public Health Service Act, and any plan that enters into agreement with healthcare providers, networks, associations of providers, TPAs, or other providers. Reporting entity is per plan. So it's really the sponsoring employer's EIN. So you can have one plan that covers more than one employer. It's not the options under one policy, such as an HMO or PPO. That's still one plan or one reporting entity. And technically, the reporting entity is responsible for the attestation. So if you happen to have more than one reporting entity, so for example, and I know this gets a little complicated, but let's say you're part of a controlled group and two members of the controlled group have different plans than other plans, then you might have more than one reporting entity. So the submitter is the individual who completes the field on the platform. The submitter cannot submit it electronically without the attester reviewing and signing it. Quite frankly, it's easier to have the submitter and the attester be the same person, because the attester is the one that's really responsible for the attestation on behalf of the reporting entity. So they can be the same person, but you may have a situation where you have somebody just complete all the information and then it's given to the head person in the department to do the attesting. So that's why they have the different references there. So how to submit it? First of all, you log in to the CMS portal. Okay. You are required to get an authentication code to access the web form. So the federal government generates the code and sends it by email. So the first time you go on, you can see in that red box in the bottom, it says don't have a code or forgot yours. So you enter the email that you want to use. So remember to enter that email and click submit. The code should come within 10 minutes. If you don't receive a code within 10 minutes, you may make another request or call the number. Now the instructions have an email address that you can send something to, but it might just be easier to call. This code is active for 15 days. Hopefully it won't take you 15 days to complete it. I would recommend that after reviewing this, you can get your information together and you can sit down, hopefully in one take, and go ahead and do this. But let's just say you can't, you do have 15 days. So once you've received the code, you go back to the landing page and enter web form now. You enter your email address and your code. Please remember that when you're working on this, if the web form is inactive for 15 minutes, the session is going to end and only information retained as of the last time you hit save. So you don't want to let it go dormant or get busy doing something else. Make sure you've saved all of your information so you can hit save and continue or save and exit, as you'll see. If your code expires before the submission is complete, so over 15 days, you can use the same email address. You're going to get a new code and you'll have access to the same saved information. So here is your dashboard. I know it's not a perfect picture, but this is the dashboard, and in red, you'll see where you can review all your progress. So if you have to save and exit, you can keep coming back to this dashboard. And under Get Started, you can download the instructions in the user manual. Again, I'm going to be sending this out to everyone. You can download the reporting entity Excel template if you have more than one entity. And then once you've got everything, you click Submit Gag Clause Prohibition Compliance Attestation. So first, we deal with the submitter. Again, the submitter and the attester may be different people. So you're going to enter the submitter's information. their name, their position, email, phone number, employer. Now, on this line, I'm really talking to clients who have self-funded health plans, not individuals who work for health insurance carriers. So assuming that you are submitting on behalf of the plan, the question comes up, by what type of entity are you employed? Well, you're actually employed by the group health plan. You're really not employed by the group health plan, you're employed by the group health plan sponsor, but that's not an option, so you choose the group health plan. You should click Save and Continue, or if you can't, click Save and Exit. Then we go, as you might imagine, to the attestor's information. If the submitter and the attestor are the same person, you just check submitter is the same as the attestor, that's in red there, and the information will automatically be filled in. If not, you're going to complete the attestor's information, the same information. Click Save and Continue or Save and Exit. Now remember, if the attestor is a different person, it's a different email address, and that attestor needs to know that they're going to get a confirmation email. So if the attestor is different than the submitter, after you select Save and Continue, you're going to see, let's confirm the attestor's email address. That's going to pop up. And you're going to ask the submitter to confirm the attestor's email address so that the system can then send them a unique access code, a link to the system, and a submission ID for reference. So you'll want that attestor to know that an email is coming to them. It's very important. So reporting entity details for one plan. The first question is, if you are submitting on behalf of more than one plan, click yes. You can see it's already checked no. So you're submitting here for one plan, so you check no. The reporting entity is actually the group health plan, but the group health plan probably doesn't have its own EIN. So you put in the EIN of the plan sponsor or the employer. You don't use dashes, and you're going to use leading zeros if the EIN is less than 9 digits. Now you're going to put in the name of the reporting entity, and so that's going to be the employer or the plan. And it's going to be one of three. It's either going to be a church plan, an ERISA plan, or a non-federal government plan, or a health issuer. And let me here go through this also. Then a screen comes up and it asks you if you're attesting for all provider agreements. So if you are a self-funded plan and all of your agreements are integrated, so let's say it's with Cigna and Cigna provides the contracts for everything, and then yes, you will attest for the medical, the pharmacy benefit, behavioral health if you have it. If you are only attesting for the medical, but your pharmacy benefit manager is attesting for the pharmacy, then you're only attesting for the medical. I know this is a new provision, and so some of you may have questions. So that's fine. You can contact your broker or contact me as you get involved in this. But as it goes on, it should be an easier attestation to do. If the reporting entity is an ERISA plan, then you provide the 3-digit plan number that you include on the Form 5500. If the plan is not subject to a Form 5500, the instructions say enter NA, but I attended a CMS webinar and the CMS agent specifically said the instructions were wrong and put in 3 zeros, 000. To be honest, I don't know what's right. I would think that they would update the instructions and post updated instructions, but you can choose either option and see which one works. So again, if you are attesting for all provider agreements, you select yes. If the different vendors are attesting, only select the benefits you attest for. If the option is other, a text box will display to describe the agreement. So when would you have an other? Maybe you have a wellness plan that actually qualifies as a group health plan. I mean, typically it's going to be your medical, your pharmacy, behavioral health. And then after clicking save and continue, again, you can click save and exit and come back. But after you click save and continue, there's a box that's going to come up where you can click next. If you are attesting for one plan of a reporting entity, you then get to skip to slide 35. If you are attesting for multiple plans, we're going to go through that quickly. That is actually going to be probably the exception and not the rule. All right, so let's talk for a few minutes about multiple plans of a reporting entity. So it's going to come up, are you submitting on behalf of more than one plan? If you check yes, then you have to upload a reporting entity Excel template. You actually have to complete some information in an Excel template and upload it. When it's uploaded, and this is not the only time I'm going to see this, they're very specific in the instructions. It must be in tab delimited text format or it will not upload. So I know the font on here is small, but I've copied and pasted some information from the instructions. So you can see you have to complete the template. It's going to ask you the name, the EIN, the plan number, all of that information. Each reporting entity's information should be on a separate row. Do not make any changes to the column titles or rearrange the columns. Leave inapplicable fields blank and don't populate with any text, including NA, a space, or a zero. Do not include apostrophes, single quotations, inequality signs, asterisks, and slashes in the cells. If you do that, it's not going to save and it's definitely not going to upload properly. Marks that are placed directly over letters are allowed, such as tildes, umlauts, and accents in any cells of your Excel file. You know what I recommend? Keep it simple. To the greatest extent you can, just keep it simple. Now, you're going to want to save the file to upload it. Again, this is only if you have multiple plans. So you first save your file as an Excel workbook and then save it in the text tab delimited format. Again, a file that is not in the tab delimited format cannot be uploaded. And you cannot have special characters. So you can see pages 14 to 17 of the annual submission web form instructions. That's where I took most of this information. So if you have any questions when you're going through it. You always want to create a backup copy of the template before you submit it. And that's going to be your XLSX version. And then you're going to save the text version that you're going to upload. And here's an example of how you choose tab delimited text. You know, you're just going to save it as that. If it's all uploaded correctly and there are no errors, the file is going to be highlighted in green with a check mark with a date and time stamp. You're going to also see a delete button if you need to delete your submission, so if it's not right. And if you need to make corrections, that's why you want to have a backup copy of it. You'll see a list of the field names that require correction, description of the error, prompts to help resolve it, where it is in the file. And so you can view errors or print errors as a PDF, and then you can fix it in the XLS file and then save it again as tab delimited. And then once uploaded and it's revalidated and it's all good, then you're going to get to see a next button to click. So here we get to our pledge where we review the submission and attest. So it comes up almost like a shopping cart. If you need to edit anything that you've put in there, you can use the edit buttons. Those are highlighted in red. So please review it, make sure everything's right. If the information is correct, hit save and continue. And remember, the attester is the one who's responsible for submitting it, not the submitter, if they're two separate people. So you're going to verify your entity type for attestation. So clients with self-funded plans or vendors should check, I am attesting on behalf of group health plans, including non-federal government plans and health insurance issuers offering group coverage. That is actually highlighted in red on the screen. When you click that, the attestation language will display. Now, it looks very small here, but it's basically going over and saying, on my honor, that we are not doing anything wrong, that we do not have gag clauses in our contracts, and we comply with government rules and regulations. So this is where the attester comes in, and they say, I attest that all information in this submission is accurate. They enter their full name. Remember, it's going to have to match. Everything's going to have to match what they signed up for, and then complete the submit button. Once it's been submitted, you're going to see a submission successful message. We recommend you download your submission receipt, and selecting return to dashboard takes you to the dashboard where you can download receipt and you can print and save a copy of the receipt. Okay. So that completes the submission part for the CMS attestation. So it's really not that difficult. It's more of just a nuisance on your to-do list. I highly recommend you do this sooner rather than later. Now, if you change to a self-funded plan in December, for example, you would have to do it in December. But if you're in a plan now that ends on or after December 31st, and you're subject to completing this, go ahead and complete it sooner rather than later. There's a lot better things to be doing at the end of the year with holidays and celebrations than worrying about filling out your prohibition compliance attestation. Have to submit them electronically. There's only one exception if you issue fewer than 10 returns. That includes your W-2s, your 1099s, and your 1094s and 1095s. So it really means everybody has to e-file. Applicable large employers have to e-file. Most of them do, but if you're an applicable large employer and you've been filing with the IRS in paper, you cannot do that any longer. To file through the Affordable Care Act information return air system, you must set up an account with the IRS. That could take up to 30 days or more, or you could use a service such as Yearly and file electronically. I would always review it with your tax specialist. We do have a podcast, HR on Mike, where we and my partner, Barbara Jennings, who is an employment specialist and specializes in FMLA policies and employment-related issues. And so we encourage you, if you have any questions regarding benefits or employment, please let us know. And if it comes to me and we need Barbara, I'm happy to loop her in. She's just such an incredible resource and such a great partner. It's just such a blessing to be able to have her on our team. So, but we also like to post episodes about questions that we get on a regular basis. So please feel free to check us out. We're also on Spotify. So with that, I'd like to thank everyone for attending.